Hello everyone. There's something I really want to discuss today that's very important, and it's about this talk in Washington that they want to have universal health care. Basically, that every member of society should have access to health care. Now, on paper, this sounds like a great idea, especially for people in the middle class, people that can't afford health care, especially when they really need it. If somebody gets sick, how are they going to pay for medical expenses? Now, on paper, it sounds like a great idea. However, you have to ask yourself a question. Why is healthcare so expensive in this country? Why are the costs so high? I was thinking of an answer. Reports have come out that 60% of this country is obese. Now, at the same time, reports have come out that the United States, as a developed country, has the highest healthcare costs. Now, do you see a connection here? I mean, I do. What causes people to get sick? Well, many studies have come out that it's linked to obesity. Many of the diseases which contribute to high healthcare costs is because people are obese. That's 60%. That is a staggering number, okay? And that's causing high healthcare costs. So if you think about it, you know, if they're going to take healthcare and they're going to basically nationalize it, and you're going to have universal health care, the 40%, okay, and people that are healthy are going to have to pay for the people that need it. There's 60%, all right? Like I said, you know, obesity is linked to a lot of illnesses. Now, there's a lot of programs in this country which may seem socialist, such as welfare, but, you know, this is different. This is completely different. This is what I call suicidal socialism. Because what you have over here are people that are basically throwing their lives away. And of course, not to be insensitive to everyone. There are some people that have an overweight or obese condition because it may be because of genetics or other reasons that are beyond their control. I'm not talking about those people. I'm talking about most of these people. You know, the 60%, the lion's share, from what it seems to me, you know, these are people that are basically eating their way to their grave. You know, they have high-fat diets. They don't exercise. Many of them may smoke, lack of sleep, high stress levels. I mean, you name it. Many of them may be doing all these things at once. I mean, they're basically throwing their lives away. And then when they get sick, you know, they complain, we need health care. I mean, that's just incredibly goofy. Here you have people that basically want to throw their lives away. They have the ability to stop what they're doing, to live a healthy lifestyle, but instead of doing that, okay, they want to throw their lives away, and they want you to pay for it. I mean, that's incredibly goofy. It's as if you have to go out there and buy goofball, you know, one of these people in the 60% category, you know, most of these people, a car. You got to buy one of these goofballs a car so they can take it and ride off a cliff. I mean, it's incredibly goofy. You're giving them means, money, to continue to destroy themselves and extend that destruction, to make their lives more miserable when they're suffering with these diseases as a result of bad choices, right? And they can continue to destroy themselves. And this really dates back to post-World War II. A lot of it does. You know, it was a time of entitlement, where this country was the most powerful country in the world and emerged from World War II as the most powerful nation in the world. And instead of a time where people rationed their food, they started to eat a lot. And then over the course of time, they started to develop chronic illnesses. It took time for them to figure out that overindulgence, lack of exercise, and everything else together, of course smoking and everything else together, is causing a lot of illnesses. All right? But this has been figured out already. This is over 60 years, and these goofs are still doing it. I mean, it's just incredibly goofy. I mean, it's as if the government wants to build safety nets around all the major suspension bridges in the United States. So therefore, when people decide that they want to jump off bridges, to put safety nets around these suspension bridges to prevent them from committing suicide, to catch them from jumping off. That's just crazy. You know? It's just incredibly goofy. I mean, they want you to pay for all these things. And like I said, out of all socialist situations, out of all programs which may seem socialist, I mean, this is the worst one ever, because these people actually want to destroy themselves. I mean, did it ever occur to you that maybe healthcare costs would be a lot lower if people made the right decisions? If they would eat less and eat healthier foods, have a higher vegetable content, a higher fruit diet, get more exercise, stop smoking, get more sleep, make good choices. I mean, did it ever occur to you maybe healthcare costs would be a lot lower and it would be more affordable? If you look at other countries that have universal healthcare, it makes more sense for them because they're healthier countries. They make better decisions. In this country, it's just crazy. It's not like a socialist program where you're paying for something, right? And somebody is underprivileged and they need money. It's a different situation here. In this situation, you're just giving somebody money to continue to live a reckless lifestyle and to basically extend their lives to be even more miserable and to continue this destructive lifestyle that they have. What these people need is education. These people actually want to destroy themselves. And they want you to pay for it. I mean, it just doesn't make any sense. It just doesn't make any sense.